Good morning, everybody. Okay, so today we're going to be starting our mental and emotional health unit. So, the first thing today that we're going to be covering is the stigma that surrounds mental health. So, I want you to take a minute and think about to yourself, what does that mean? What does it mean when you hear the stigma of mental health? And what stigmas can you think of that surrounds mental health? Okay, so all right, well, let's get started with our little PowerPoint here we got. And so we got the stigma in mental health. So these are some of the common phrases that you might hear, like you shouldn't have kids, you just pass on your issues. So what do you mean you can't get out of bed? It's not like your legs aren't working. Kids and teens can't have mental illness. What do they got to worry about in life? These are some of the things you can hear people say when they're talking about mental health. So these aren't really good things. So, what is stigma? The definition of stigma is a mark of disgrace associated with a particular circumstance, quality, or person. So, it's kind of like you're throwing a stereotype on them. So, the stigma of mental illness is when someone views you in a negative way because you have a distinguishing characteristic or personality trait that's thought to be or actually is a disadvantage. It's you got a negative stereotype. So, a public stigma involves the negative or discriminatory attitudes that others have about mental illness. It's kind of some of the things that was on that little picture at the beginning. Self stigma refers to negative attitudes, including internalized shame that people with mental illness have about their own condition. That you're thinking you're could be thinking that you're stupid or you shouldn't be like this. What's wrong with you? It's kind of how you view in yourself. So institutional stigma is more systematic, involving the policies of government and private organizations that initially or unintentionally limit opportunities for people with mental illness. Examples include lower funding for mental illness research or fewer mental health services relative to other healthcare. So institutional stigma could be doesn't always happen, but sometimes you go to the emergency room or something, they find out you have a mental illness, they're just going to assume that whatever's wrong with you, it's just because of your mental illness when it could have absolutely nothing to do with it at all. Doesn't always happen, but it does sometimes. So the problems with stigma in mental health. Stigma can lead to discrimination. It may be obvious and direct, such as someone making a negative remark about you, or a treatment. It may be unintentional, subtle, such as someone avoiding you because the persons assume you could be unstable, violent, or dangerous due to your mental illness. I know we've seen people all the they just discrimination. Everybody's knows what it is. Most of the time, it has nothing to do with mental health, but not everybody suffers from mental health issues. But the people that do, they see it a lot of the times. We might do it, but we may not really even be aware that we're doing it. So if you have a mental illness, you might judge yourself. So it not only directly affects individuals with mental illness, but also the loved ones who support them, often including their family members. So if someone's suffering from a mental illness, say depression, sometimes their family members could be looked at and be like, well, what are you doing that could be causing them to have depression? They get some of the blame also. So this is a list of some of the things. So you got stereotypes and prejudice, public, self, institutional. You also got discrimination. So public, people with mental illnesses are dangerous, incompetent, to blame for their disorder, unpredictable. It's not really always the case. Self, people with mental illness are dangerous, incompetent, to blame for their disorder, unpredictable. Institutional stereotypes are embodied in laws and other institutions. So the discrimination for the public, therefore employers may not hire them, landlords may not rent to them, the healthcare system may offer a lower standard of care. The discrimination that would come with the self is the thoughts lead to a lowered self-esteem and self-efficacy. Why try? Someone like me is not worthy of good health. That's some of the things that could lead to the from the stigma and the way people think about things. So with the institutional, intended and unintended loss of opportunity. So the way that we think leads to our actions and discrimination. So the harmful effects of stigma. It may include reluctance to seek help or treatment. If you just think people are just going to think you're crazy and not do anything, then you're going to think, what's the point in going to get help? The lack of understanding by family, friends, co-workers. So if they don't really understand what it is that's wrong with you, they're more likely to have this stigmatized idea of mental illness. But the more they learn about it, the less likely they are to have this thought processes. So it also includes fewer opportunities for work, school, social activities, and trouble finding houses. So if you've got mental health issues, it could keep you from getting a good job. Your school, they may not really try very hard because they're just going to be sitting there thinking, what's the point? They're not going to learn anything. And these are harmful. It's not because they're stereotypes. Not everybody's going to be doing the same. Just because somebody has a mental illness does not mean these things have to happen or they are going to happen. And it could lead to bullying, physical violence, or harassment. We know a lot of the times bullies like to pick on people who are different. So if you got a mental illness, that could be something they start to target. It's not good. Health insurance that doesn't adequately cover your mental illness treatment. This would be institutional. They are being discriminatized towards because of their mental illness, when mental illness is a disease and you should be able to get just as much treatment for your mental health such as your physical health. But this doesn't always happen because of the stigma around mental health and the what people think. But the more we get educated about mental illness, the less likely it is for the stigmatizing of people with mental illness. So the belief that you'll never succeed at certain challenges or that you can't improve your situation. If you get the right help, mental illness is manageable. It may not go all the way, but the symptoms can be managed. So there's never a reason for that kind of thinking, either in yourself or from others. It's That's a bad way of thinking about things, and it's not going to help anybody. So more than half of the people with mental illness don't receive help for their disorders. That could be because they don't think anybody's going to take them seriously. They think people's just going to be making fun of them. Then the list goes on. But you're usually worried about something. So they may avoid or delay seeking treatment due to concerns with being treated differently or fears of losing their jobs or livelihood. So if they're sitting there working, but all of a sudden they come into depression or anxiety or whatever mental issue they could be having, it could be affecting them. Their employers may think it's going to affect their work and that they just need to let them go and find somebody who can do the job. About 3 in 4 teens seeking information online about depression said they were looking for personal anecdotes from people who have suffered in the past. A lot of the information online just goes to doctors and everything. They're not finding people who are talking about their mental illness as much. And that's what they want to hear. You want to hear things like, this is what they were going through, this is what they did to get help, and this is what helped them overcome their battles. So we got a couple videos here we're going to watch. hold on here. Let me figure it. Okay, there we go. Let me get the second video pulled up. Share the screen. And restart it.
You know that feeling where your thoughts scare you or make life tough? Sometimes it feels like no one else in the world has those thoughts or feelings. No one seems to know how difficult it is to deal with your feelings. And it's not easy to share your deepest secrets. You might think something is wrong with you, or you might worry what other people think. And all of that makes your thoughts and feelings worse. Our culture has created this environment of shame. Until the 1960s, society sent people away if they had challenges managing their thoughts, emotions, and behaviors. Over time, we learned that we didn't have to be afraid. We learned how to help people get better. We became hopeful. But there are remnants of those images in our culture today, which is why some people still feel uncomfortable talking about it. The stigma has taken new forms too. With more access to more people all the time, it can seem like the world is telling us it's not okay to be anything but perfect. The truth is, everyone has thoughts or feelings that can be hard to deal with. So why do we make it so difficult on ourselves by judging others who could be going through the same challenges we are? What if, instead of seeing labels, we saw people who are struggling and could be there for them so they didn't feel so alone? What if we looked past our fear of mental health and started to talk about it in a constructive way? What if, as a society, we used empowering words and healthy images to help people feel supported? Maybe then more of us could feel comfortable telling others when we're having a hard time. Maybe more people would get the help they need. And maybe one day we won't have to talk separately about mental health and physical health, but just health. The truth is, each of us has the power to change our culture. Will you join us? Share this video with a kid, your neighbor, a friend, and help us break the stigma of mental health.
Okay. So let me get the PowerPoint pulled back up. There we go. Okay. So now we got some steps to coping with the stigma. First, get treatment. So you may be reluctant to admit that you need treatment. So don't let the fear of being labeled with a mental illness prevent you from seeking help. We're getting to find more and more people these days need help. And that doesn't necessarily mean there's a lot more than there used to be 50 years ago. It just means that we're starting to understand more about mental health and people are finally starting to come out with it. We're starting to talk about it more because the fear and the judgment are starting to subside. So it can provide relief by identifying what's wrong and reducing the symptoms that interfere with your work and personal life. So mental illness may not be able to be cured, but there are ways to manage the symptoms, such as like depression. You're able to take medicine to manage your symptoms to where you could still have a full life and it doesn't affect your everyday just getting up out of the bed. So don't let the stigma create self-doubt and shame. So it doesn't just come from others. You may mistakenly believe that your condition is a sign of personal weakness or that you should be able to control it without help. Seeking counseling, educating yourself about your condition, and connecting with others who have mental illness can help you gain self esteem and overcome destructive self judgment. So, just there's stigma from others that people with mental illness get, but you still also still have the self stigmatization. So, you need to be able to talk to somebody without tearing yourself down in the process. Don't isolate yourself. If you have something a problem, you don't know what's going on, you don't need to keep that to yourself. Your family, friends, clergy, members of the community, they can offer you support if they know about your mental illness. If they don't know anything, there's no way they can help you because they don't know that anything's wrong. They might can see and tell something's up, but if you never talk about it, then they're not going to be able to do anything. So don't equate yourself with your illness. You are not the illness. Instead of saying, I'm bipolar, say, I have bipolar disorder. Instead of calling yourself a schizophrenic, say, I have schizophrenia. Just because you have a mental illness doesn't mean that you are that mental illness. Say if like I tore my rotator cuff one time. I never said I'm a torn rotator cuff. I say I have a torn rotator cuff. So join a support group. Every people who are alcoholics, that is a disease. They go to AA meetings. It's the same thing we could do for mental illness. There's support groups that you can talk to. So there's some local and national groups, such as the National Alliance on Mental Illness, NAMI. I don't know if I'm saying that right, but that's what I'm going with. NAMI. Offer local programs and internet resources that help reduce stigma by educating people who have mental illness, their families, and the general public. Some state and federal agencies and programs, such as those that focus on vocational rehabilitation and the Department of Veteran Affairs, the VA, offer support for people with mental illnesses. So you can get help at school. So if your child has mental illness that affects learning, find out what plans and programs might help. Discrimination against students because of a mental illness is against the law. And educators at primary, secondary, and college levels are required to accommodate students as best they can. So just talk to your teachers, professors, administrators, anybody at the school about the best approach and resources. If a teacher doesn't know about a student's disability, it can lead to discrimination, barriers to learning, and poor grades. So if a teacher doesn't know about a mental illness, you need to tell them about it and maybe even offer some to help educate them about what it is that specific mental illness is. So we need to speak out against stigma. Consider expressing your opinions at events, in letters to the editor, or on the internet. So it can help instill courage in others facing similar challenges and educate the public about mental illness. So if you hear something that sounds like it's stigma towards mental illness in a magazine, on the news, or anywhere, you can call them, send them a letter, do something to point out, say, hey, this is not right. This is not something you need to be spreading out to the public. This is discrimination towards people with mental illness. So others' judgments almost always stem from a lack of understanding rather than information based on facts. Learning to accept your condition and recognize what you need to do to treat it, seeking support, and helping educate others can make a big difference. So if someone doesn't really understand something, they're going to start judging. But the more, like I keep saying, the more we learn and the more we try to get that information out by teaching others about the mental illness, then the judgments will start to subside. They'll be able to empathize with you. They may not know exactly what it is that you are feeling and everything, but they won't be so harsh on you. So these are things you can say to help stop the stigma. Thanks for opening up to me. If somebody's talked to you, you don't necessarily have a mental illness. These are things you can say to the person with the mental illness. Thanks for opening up to me. Is there anything I can do to help? I'm sorry to hear that. It must be tough. I'm here for you when you need me. I can't imagine what you're going through. People do get better. Oh man, that sucks. You may not say it exactly in the mannerism that I'm saying, but you get the picture. Can I drive you to an appointment? How are you feeling today? I love you. And so lastly, we got things that we don't need to say. Someone's telling you how things are going badly, don't just tell them, oh, it could be worse. You just need to deal with it. Someone's doing something, you don't need to, hey, snap out of it. That's not going to be good for anybody. Everyone feels that way sometimes. When you say this, you're downgrading what it is, how they're feeling. So you may have brought this on yourself. You're blaming the person for something that may not even be their fault. We've all been there. Again, it's be like, so you're nothing special. There's just basically it's another version of just deal with it. So you've got to pull yourself together. A longer version of snap out of it. And maybe try thinking happier thoughts. Telling somebody what to think is not going to help anybody. So we got this last video here.
Stigma to me is looking at a person for something that they have or something they don't have and treating them differently because of that.
I think everyone does it. Even I do, at times. It's judgment of someone before you even know anything about them.
There are lots of examples. I mean, people who are obese are stigmatized in our society, people who are too tall or too short. And of course, there's mental illness, which is something which is highly stigmatized.
Stuff like incompetent, stupid, crazy. It's one I hear a lot.
Simply put, it's discrimination and prejudice.
Not so much in a mental health setting where you're going to see the psychiatrist or you're going to an outpatient mental health clinic, but certainly when you go to an ER.
You go in, and once they find out what you're there for, you're treated differently.
And as soon as people hear the words like, Prozac, Seroquel, Ativan, any of that, it's almost like this wall goes up.
People assume too much.
And it may have nothing to do with their mental illness, and yet they're still, think that they're seeking attention. And what they maybe really have is, a sprained thumb or something.
I've heard nurses talking when they didn't think you could hear. They were saying, she's a drama queen. So she's dismissed before any treatment is even considered.
People who label people like that don't really take their concerns seriously.
The small behaviors that people can do, like, the eye rolling and the snide comments and the dismissiveness and, the gossiping, it makes a huge difference to somebody who's in a very, very sensitive situation, who already feels very, very poorly and very, very afraid, to have the people that are supposed to be helping them, essentially not really treat them very well. It makes a huge difference.
There was a young woman who really needed some extra care. They were to the point where they were going to change physicians because they didn't feel like their physician was hearing what they needed. And when I went out to the physician and I spoke to him, and he said, "Oh, she's crazy." I said, "Oh, no, she's not crazy. She has mental health issues that need to be addressed. You wouldn't say that about somebody with diabetes, or you wouldn't say that about somebody with cancer. But because it's mental health, she's crazy. And this is what she needs." And he went into the room, and he apparently was quite different when he went in. Because the mother said to me, "What did you say to him?" And I said, "I just expressed your needs to him. I didn't say anything extraordinary."
Going into the emergency department for, severe mental health problems because you really have nowhere else to turn, and essentially being treated like you should have tried harder, or you should have done better, or you're wasting our time. And it's weird when I compare it to the experience when I broke my ankle, because I was in and out in 3.5 hours. Wasn't even in the waiting room. It was just like, "Oh, that's broken. Here's an x-ray. Okay, here's some drugs. Go home. We'll call you for surgery on Thursday." And I was just like, I'd never had that happen in my life. I was so surprised.
The youth are labeled by their teachers, by their peers. They're bullied, made fun of.
Because there's so many misconceptions out there, I was so afraid to say anything and tell people what was going on inside my head because I was afraid of what everybody else was going to say.
People do not want to believe that mental illness occurs in their family or in their patients if you're a physician. It's always somebody else's family, somebody else's patients.
People don't know how to deal with people with mental illness. They're suffering just the same as somebody with pneumonia. They're suffering just as much as. The system does not take care of people who have mental health issues. The system labels them, and what causes them to be or behave in a way that leads to somebody giving them that label is never addressed.
I'm a person first and I'm a diagnosis second. And that's like the message I wish I'd been able to convey when I was younger, when I was very much being treated as a problem, not a person with a problem.
Jessica was a happy little kid. And when she was 12, in grade 7, she developed all these physical symptoms that were preventing her from going to school. She had headaches and stomach aches and nausea, and she was admitted for assessment of her physical illnesses. When they couldn't find anything, they did a psych assessment. And at the end of the day, I was told that I had a spoiled little girl and to take her home and smarten her up. And of course, a psychiatrist, stupid me at the time, a psychiatrist told me this, so I believed it, even though this little voice in my head was saying, you know that this isn't true, you know this isn't true. But off we went, and as a result of that misdiagnosis, based purely on prejudice, I felt, Jessica ended up with 16 years of anorexia, bulimia, self-harm, failed grades, unemployment, isolation from her family and friends, extreme physical ramifications, despair, and suicide attempts. And so way back then, if her anxiety disorder had been properly diagnosed and treated, all of that would have been avoided. I don't understand why that happened. And I have spent a lot of time thinking about it. I still get very angry because I see what it did to my daughter and to me.
Mental illness, can be fatal. And when it is, it's never captured under mental illness. It's always captured under whatever they died of, whether it's asphyxiation or whether it's, exsanguination, but it never says died of hopelessness. And at the end of the day, that's often what it is.
When you've got a broken bone, you can see the x-ray, you can see that it's broken. When you've got to go in for blood work, you can see the blood results. You can see what's really there. When you've got to go in for psychiatrics, there's nothing that you can see. And I think so that because there's nothing that shows you what's really there, there's a lack of understanding.
These healthcare professionals, their opinion on the mentally ill, I would say, starts before they go to med school, before they decide they want to be a doctor. They've been hearing myths and, I don't know, just labels all their life. So I'm sure they just carry that with them into their training.
I had the dream team. As much as people told me that I wouldn't make it to graduate high school, I'd be dead before I graduate grade 12, these two told me that I was gonna make it. They just kept believing in me. No matter what bad excuse I came up with, that they just kept believing. Even though today they're non-professionals in my life, I know I can send an email along to them if I run into any kind of trouble, and they're there. They'll pick up the phone, they'll give me a call, and they'll give me a little bit of support to keep me going. They're phenomenal.
I've met a lot of great people and great doctors, other patients. How I can feel when someone cares or is listening, for me would be when I guess they take an interest in what I'm saying. They pursue what it is I'm saying. I've been pretty lucky through despite what I live with, what I go through on a daily basis, to receive the help that I've been given.
I remember in particular being in an emergency room and really not having an easy time and really, feeling very out of control. And this nurse came in and started talking to me, and she's talking to me for 45 minutes, just about her family and about myself and about what plans maybe I would have for the future and about how, her sister had a mental health problem and gotten through it all okay. And at the end of it, she gave me a hug, and I suddenly realized she'd stayed 45 minutes after her shift just to talk to me. And I was like, wow, I've never forgotten that person.
We can do it by asking the questions, by being receptive.
If they're telling you something's wrong, believe something's wrong, don't think they're lying to you. Don't be closed-minded. Be patient. Always be patient with them.
the best time to treat mental illness with youth is early on. Like early intervention is the key to successful treatment at this point. What's happening is people aren't getting treatment until they're in complete crisis because they don't want to go and encounter the stigma or the system is completely overloaded. And that's why we need to have less stigma for youth so they get better treatment faster so they don't end up having a lifetime of problems.
I really believe that there needs to be more education on the medical side of things as far as mental health is concerned.
And I think that we have to do a better job of trying to understand better how pervasive, how common, and therefore not stigmatizing is mental illness. And I think the more we talk about it, the more we understand it, and the more we have practical examples of how it's an everyday occurrence at some level, then we destigmatize it and we deal with the issues and try to make people better.
Okay, so. Alrighty, so during this lesson and while you were watching the videos, were you thinking of a personal experience? If not, that is okay. If you did, that is what needs to be fixed. Mental health issues affect both men and women. It should not be looked past just because someone cannot see what is wrong with you. The more we learn about mental health, the better chance we have of getting past the stigma that surrounds mental health. Just because you suffer from mental health issues does not mean you are incapable of living a full life. I want you to think about, why do you think people still think negatively about people with mental illness? Has it gotten better in the last 50 to 100 years? Are there still ways that we can improve? So that is all for today. I want you to think about those things and answer the questions that I have for you. That's going to be covering this lecture. And if you come up with an answer, go ahead and just write at the bottom an answer to those questions I just gave to you. And just write a little something. Tell me what you think. So that is all. I'll see you next time. Bye.